there's a lot to suggest that this increase that we're seeing now in COVID activity is going to continue, perhaps even get even higher in certain parts of the country. And as they say, it's sometimes darkest before the dawn. At the same time, there's a promise of several new vaccines on the horizon. Of course, right now we don't know what the efficacy or the safety profile is of any of these yet. But there is at least that promise up in the horizon that we will get out of this. But before we get out of this, there's going to be a lot of people who are at risk, and we need to keep them safe.
I think the first step is really the simplest, but the hardest is I think this thing, wearing a mask, then the hand washing, sanitizing, and then really stay out of gatherings. I mean, these sort of mass gatherings, keeping the distance, it's as simple as that. I think that's so crucial. I mean, heart disease patients, cancer patients, I mean, I think there's nothing more effective than that, to be honest. And then obviously for the heart disease patients, we always say, I mean, the cardiovascular health is what we like to emphasize. And that would be the healthy diet. That would be taking care of all your risk factors with medications as you need them.
What we're seeing through this is that it's often not the high-risk people who are doing the high-risk activities. It's the lower-risk people. So young adults who are otherwise quite healthy, going out, going to bars, coming home with some sniffles and then visiting their grandparents. And then those are the ones who end up getting sick and dying. And so it's not just focused on those with the highest risk of complications or death. I think this is something we all need to focus on.